we are going to discuss TFL, the tensor fasciae lata. It is a hip flexor. It is also a medial rotator. Okay? It begins right up here on the iliac crest and inserts into the iliotibial band. So again, just like glute max, TFL does not insert into the greater trochanter. It's superficial to it. So glute max comes around like this, TFL comes down like this, and they join together and become the IT band. Okay? So let's talk about the IT band. Look at it in an anatomy book. Okay? It's a big white sheath of tendon that runs along the lateral part of the thigh. I like this definition. It is a longitudinal fibrous reinforcement of the fascia lata. Okay? It assists with extension, abduction, lateral rotation of the hip, and it provides lateral knee stability. The IT band, because its primary job is structural support, TFL attaches into it, lateral quad attaches into it, lateral hamstring attach into it, so it's going to assist and reinforce all of the movements that the muscles around it do. Glute max, lateral hamstring, lateral quad, right? They all attach onto there. So that helps make all of those muscles stronger. So it assists. The IT band is not a muscle, it's a sheath of tendon. So it doesn't expand and contract like muscle, but it helps. It's an assister to all of those actions. It begins on the external lip of the iliac crest and inserts on the lateral condyle of the tibial, also known as Gerdy's tubercle. Somebody named Gerdy got to name that after themselves. So TFL, ITB, let me make sure I'm getting the bottom of your leg here. Peroneals longus. So we're going to talk about some more muscles in the shin. It is the lateral shin. So the tibialis anterior is over here. Peroneals are out here. It is a plantar flexor and a pronator. Begins on the fibula, the lateral fibula, and inserts on the first metatarsal and medial cuneiform. Peroneus brevis is a plantar flexor and pronator. Begins on the fibula, inserts on the fifth metatarsal. Peroneus tertius, that means it's short. It is a dorsiflexor and it everts the foot, which is to come away from, so inversion is towards the midline, eversion is away from the midline. Begins on the distal anterior surface of the fibula, it's all the way down here, inserts on the dorsal surface of the fifth metatarsal. So it's a short little muscle like that. Its primary function is dorsiflexion and eversion. So what do we do with all these muscles and structures? IT band. Again, it is not a muscle, it's a sheath of tendon, it's fibrous, it's very, very dense, it's very, very strong. Runners in particular, the joking name for IT band is runner's bane. Most runners hate their IT bands and hate the fact that it even exists because it's always painful. You can get iliotibial band syndrome, ITB syndrome, which usually manifests in lateral knee pain. But how do you work on IT band? There's all kinds of different discussions in current literature about, can you actually affect the IT band? I believe you can. It is living material. I believe anything that is alive can be affected by massage therapy. So I believe that we can loosen it, and even if we can't loosen the actual structure, we can loosen the muscles around it. So IT band stretches are usually going to be across. So I usually just dig into glute max while I do a stretch like this. You can also use elbows. I don't ever work in long sleeves. Forearms, okay? You can bend the knee if the person is uncomfortable. If that causes pain, by all means bend the knee. Okay? Strip, cross fiber, okay? Hold your leg right there, and then relax and come with me. Okay? So a little PNF, a little active range of motion. TFL, it's easier if the person's face down. Lift the leg up because it is a hip flexor, so you want to take it into extension in order to stretch it. Peroneals, right? You want to be able to take them into passive dorsiflexion, or passive dorsiflexion, passive plantar flexion. Get all of those movements going, have them engage with you, have them participate, have them actively engage. Sports massage, pre-event, quick, light, just movement, effleurage, petrissage, kneading. Okay, get all those muscles working, get all the blood flowing so that that person is ready to go into their competition. Okay.